The death of Anna Garcia. The case file number was 77. Her age was 38. Her weight was 165 pounds. Her height was 64 inches. Her race was Hispanic. Sex, female. And she was last seen walking her dog.
So what is shown in this picture is the crime scene in which Anna was found dead. The evidence is labeled from what is closest to Anna to what is farthest from her. Starting with number 1 would be the blue lips and fingernails, which show the lack of oxygen getting to the rest of her body. Number 2 is the vomit just beside her mouth. Number 3 are the pills spread around the scene. Number 4 would be the blood spatter on the side of the table where she hit her head. Number 5 is the bloody shoe print. Number 6 is the insulin pen or the Humalog, which is what she tried to pump insulin into her body with, but it was a failed attempt to keep herself alive. And number 7 is the fingerprint, which is on the side of the table, which is not visible at this angle. And number 8 is the spilled juice just below her to her side. There's different ways to investigate a crime scene. There is the spiral method where you and your team can start from the center and circle outwards, or you can start from the outside and circle inwards towards the center. There is the zone method where you can divide the crime scene up into, let's say, 4 zones, and then label the evidence in each zone. Then there's the wheel or ray method where you and your team will start from the center point of the scene and work your way outwards. We use the wheel method in our investigation of Anna's death scene. And then there's the grid method where each member of the team lines up and will walk across the scene vertically and horizontally together. That's for larger scenes. Steps taken during and after an investigation. First step is always to close off the crime scene and make sure none of the evidence is disturbed. If it's moved, then that could really make it a lot harder to have a successful investigation. The next step is to take photos of the scene and label the evidence. Any blood, vomit, and medications should be taken as a sample to perform tests on. Then the next step is the body is taken by a coroner who will perform the autopsy. Number 5, a toxicologist will perform tests on the samples of the blood, vomit, and medications to see what she was taking before she died. And then the body is looked at by the coroner to determine how she died.
This is the death of Anna Garcia. Case number is 77. She's age 38. She weighs 165 pounds. She's 64 inches tall. Her race is Hispanic. She's a female, and she was last seen walking her dog. And when she was walking her dog, she was dressed as it was winter when it was in the middle of the summertime. So we believe that Anna Garcia died of heart failure. And heart failure is a condition that can last for years or even a lifetime, in which the heart does not pump blood as well as it should to meet the body's needs. Diabetes is one thing Anna had, and having high glucose can damage your blood vessels and the nerves that control your heart. She also had sickle cell anemia, and she was diagnosed with this when she was younger. She went to the doctors because she was gaining weight quickly and had a side effect of Fatigue, and they were not sure why, and then they realized it was sickle cell anemia, and this can increase the cardiac output while only having a minimal increase in heart rate. And Anna also had cholesterolemia, which is a hereditary thing, and this can result in having high cholesterol.
Anna had type 1 diabetes, which is when there's no insulin being produced. Insulin is what regulates your blood sugar. So now her blood is becoming thick because there's an excess amount of glucose or blood sugar in her body. This will raise blood pressure because these sugar molecules are big, and now blood can't get to her hands and feet because it's having trouble getting through the small tubes. And all of this is going to lead to damaged blood vessels. And when there's damaged blood vessels, the vessels won't be able to bring oxygenated blood to the muscles. The muscles won't get oxygen, and that starts a whole cascade of other bad things. Anna also suffered from sickle cell anemia. This is when your red blood cells are shaped like a sickle. These will block blood flow, as shown in the image. Without blood, the organs will be deprived of oxygen. This can damage the spleen, and the spleen keeps the body's fluids balanced, and when the spleen is damaged, this will lead to more infections. Another key contributor to Anna's death was heart disease. Heart disease is a number of different things that will affect your heart. Anna had high cholesterol, which causes atherosclerosis, and atherosclerosis is when fat and cholesterol build up in the arteries and cause the artery to narrow. This can completely block off blood flow. She also had coronary artery disease, which is the narrowing and blockage of the coronary artery, which is located on the heart. She also had high blood pressure and left ventricular hypertrophy. Left ventricular hypertrophy is when the left ventricle is working too hard to pump the blood, and when it's working too hard, you will have heart failure. Events leading to Anna's death. This is what Anna was doing as well as what was happening in her body. She was eating foods that were high in sugar before she went to bed, and when she woke up, she felt sick, so she took her dog for a walk like she does every morning, and that walk is about the only physical activity that she gets in for the day. Anna's blood sugar was building up, and her veins and arteries were becoming clogged. Anna's coronary artery is already narrow, and her blood pressure is now very high because she had coronary artery disease. Coronary arteries supply oxygen and blood to the heart. So if the coronary artery is clogged already and it's very narrow, then her chances of survival are pretty low because it won't be able to give oxygen and blood to the heart. Anna's high cholesterol is also building up on the walls of her arteries. The blood is unable to travel through the heart, causing left ventricular hypertrophy. Anna's heart can no longer circulate blood and does not have oxygen, causing heart failure and a sudden death.
For a diabetic, did not eat well. She kept a food diary, and one thing that she didn't put in her food diary was how she would have a few glasses of wine every single night. Sunday, August 12th, she had a full diary of what she ate, and for her breakfast, she had 1 cup of Cheerios, 1/2 cup of skim milk, 1/2 cup of blueberries, and for lunch she had 1 cup low-fat strawberry yogurt, 6 Ritz crackers, 1 cup canned low-sodium vegetable soup, 1 12-ounce can of Coca-Cola, and for her snack she had 1 single-serving bag of potato chips. Dinner, she had 2 slices of thick crust pepperoni pizza, and it was a 14-inch pizza. She had 2 cups salad, 4 tablespoons of Caesar dressing. For dessert, she had 1 cup of vanilla ice cream with 1/2 cup mini marshmallows and 5 Oreos. So her diary was not complete Monday, August 13th, and that is the day that she died. And what she had was 1 cup of whole milk and 1 biscuit. And she was having way too much sugar. The dessert Anna had the night before was too much. She also had a full can of Coca-Cola, and that can equal up to the total amount of sugar you should be taking in one day. Another thing wrong with what she ate was most of these foods are high in glucose. The 2 slices of thick crust pepperoni pizza, the bag of potato chips, the 5 Oreos, the cup of vanilla ice cream, 1/2 cup of mini marshmallows, the 12-ounce can of soda, and 6 Ritz crackers. These sugars provide less energy for Anna because they have fewer intermolecular bonds. This was a lot of sugar to take in, so Anna's blood sugar likely got higher, and that led to blood vessel blockage. There was also ketones and protein found in Anna's urine, so her body was unable to soak up all the glucose. She had type 1 diabetes, so she always had to be careful what she was eating, and sometimes she just did not eat.
Anna's circulatory system was being compromised by her heart disease. This means that her blood vessels began to become narrowed and have blockages in them. Because her circulatory system was compromised, this means that diseases of her arteries would occur, eventually going to her legs, then affecting the blood flow to her brain. The muscular system was also being compromised because her muscles weren't getting blood since the arteries and veins were being clogged by blood with too much glucose. Her nervous system was also compromised by her heart disease. Since she had her heart disease, there was a abnormal activation in sympathetic nerve system. This abnormal activation would actually eventually start to worsen her heart disease. And other abnormalities that occur with this is increased urinary catecholamine levels, increased plasma nephrin levels, which is a hormone that is sent by the sympathetic nerves, increased sympathetic tone, and abnormalities in cardiovascular reflexes. Medications that Anna was taking was Vasotec, an ACE inhibitor for her high blood pressure. This actually wasn't found in her toxicology report, so that leads us to believe she wasn't taking this for 3 to 4 days prior to her death. There was no alcohol found in her toxicology results, so that leads us to believe that she was taking her antibiotics for her urinary tract infection. Also, there was trace amounts of hydroxyurea in her blood, so that means that she was taking her medicine for her sickle cells. And her blood sugar was 280 milligrams over deciliters. So that means that that's shown because the night before she wasn't eating right and everything, but that also leads me to believe that she wasn't taking her insulin Humalog because it was found next to her body at the crime scene. So that shows that she was probably trying to take it before she passed. Daily, she took acetylsalicylic acid, which is aspirin. She also took her arthritis medication because she had avascular necrosis in her hip joint. This means that her hip bone was dying, causing her joints to collapse because the main artery that supplies blood to the bone was being blocked by her sickle cells. Careers involved Anna during her life and postmortem. Anna would go to see a cardiologist for her heart disease. A cardiologist gave Anna her heart disease diagnosis and continued to help her with treatments. She would go to a hematologist to get her treatment for her blood disorder, sickle cell anemia. For her diabetes, she would go to a dietitian and an endocrinologist. A dietitian helped her come up with a healthy meal plan and with foods that are healthy for her. The endocrinologist who would diagnose her and treat Anna's hormone imbalances by restoring her normal balances of hormones into the body. To get the diagnosis of her urinary tract infection, she would have went to see her primary care physician and would have been prescribed medication. Once Anna passed, a toxicologist checked her fluids to see if there was evidence of toxins or chemicals. A forensics pathologist came to the crime scene since a murder was suspected at first. A blood spatter analysis came to see what kind of blood spatter was there to help determine the cause of death. And the crime scene investigator came to investigate Anna's body and everything around her. Relationships between diseases. A1C tests measure a patient's average blood glucose over a span of 90 to 120 days, which is a lifespan of a red blood cell. When patients have the condition sickle cell anemia, their blood glucose could differ when it comes to the A1C test. This occurs because the average lifespan of sickle cell is 10 to 20 days, which will reduce A1C concentration. In a study with an African American woman who has both type 2 diabetes and sickle cell anemia, her A1C results came back that her glucose levels were 50 to 320 milliliters, which was unusual because her A1C was always less than 6%, with healthy levels being 4% to 5.6%. Diabetes and heart disease. About 2/3 of people diagnosed with diabetes have high blood pressure. According to the Diabetes American Association,
People who have diabetes are 2 to 4 more times likely to die from heart disease or a stroke than people who have heart disease. Having high glucose levels over time will cause your arteries to stiffen or become hard, damaging them. You will most likely develop the condition atherosclerosis, which is when fatty material builds up on the inside of your blood vessels. This will lead to blockage of your blood flow to the heart or even to the brain that will cause a heart attack or a stroke. Sickle cell anemia and heart disease. Having sickle cell anemia starts an increase in cardiac output with a small increase in heart rate. There starts to be a noticeable development of progressive proliferate system vasculopathy, which is growth in heart disease. There will also be an increase in pulmonary hypertension and left ventricle diastolic dysfunction. Pulmonary pressures are an enormous risk with sickle cell anemia. Also, cardiac chambers dilation and increase in left ventricular mass. Sudden death is an increasingly recognized issue with patients who obtain both conditions, sickle cell anemia and heart disease.